and that's really important. But my talk doesn't really reflect a lot on evidence. It's really a conceptual issue that I'm interested in here. But I will mention a little bit evidence along the way as well. So I want to start with a little bit of motivation. So really, I mean that's sort of personal history, why I got interested in that. And so over the past months, many headlines have, I mean, you've seen that a lot, headlines claiming that the number of corona deaths is vastly overestimated. And this claim is supported by the following. So in these reports, the claim is made that in these reports, the official statistics conflate deaths with the virus with deaths due to the virus. And therefore they presuppose that there is a clear distinction between these two things. So the idea is that the official statistics count all the deaths of people who have the virus, but people did not necessarily die of the virus, or that the virus was the causal agent in bringing about their deaths. And so I follow this literature quite a bit, and because I'm a philosopher who's interested in causality, I thought, hey, that's a causal issue, so maybe we have something to say about that. And so I started thinking about that. So here are just a number of examples. This is from The Spectator, Dr. John Lee. The way COVID deaths are being counted is a national scandal. And, talking about exactly this thing. This is about the member of the expert panel, Bergs, in the United States. Bergs says that government is classifying all deaths of patients with coronavirus as COVID-19 deaths, regardless of the actual cause. So stating exactly that point. This is something from Italy, when death from coronavirus is a matter of interpretation. Asked why, and then this article says, asked why Italy had a high rate of death due to coronavirus, government officials there said it was because they were using a broader definition for such deaths than other countries, counting any victims who had tested positive, even if other illnesses were at fault. So again, making this causal notion here that there are other conditions that are at fault, that are causally responsible, while corona is something like a condition, is present, but was not a causal agent. And so these kinds of headlines and these articles have triggered me into sort of thinking a little bit about that. And so I want to challenge this view here. So I don't want to argue that there aren't some straightforward cases. So some cases where you can actually tell this is a death where corona is a mere condition, where a person died of something else and then corona was present but didn't actually cause it. And there are other cases where it's very clear that corona is responsible for the death. But in the vast majority of cases, this distinction is just unclear. It's very hard to draw. And so that's really the aim here. And so let me then start with the clear-cut cases. So if you have a dying off, so where coronavirus is said to be responsible, the causal agent or whatever, so you have the virus, and that causes some conditions such as pneumonia, that might cause some other conditions such as sepsis. You call, actually, I'm sure you all know this, but there's the virus, which is called SARS-CoV-2. And then there's COVID-19, which is the disease. So that's a bundle of symptoms. In this case, I just used two examples. So pneumonia very often causes sepsis. And then that leads to death. And there's just nothing else going on. So this is a healthy patient who otherwise would have lived a long and healthy life. And then dying with, you also have the SARS coronavirus, which is present in your body. Then you have a car crash and you die of the car crash, and the virus didn't do anything to contribute to that. So that's a clear case of dying with. You can have a similar situation where the virus actually causes the disease, but then the disease doesn't contribute to death. So these are very, very clear cases where it's clearly a case of dying with. However, numerically, these two types of cases are extremely rare. what happens a lot more frequently is that you have the virus, which is somehow connected to death, but you have so-called underlying health conditions. And so I give a number of figures here from different countries. So in the US Center for Disease Control, you have an estimation is that 90% of cases are like that, so that the COVID deaths, or I mean the patients who die of COVID or with COVID have underlying health conditions, about 90%. For Italy, you have an estimation of about 99%. Very few, and I will talk about this a little bit more later, very few post-mortems are done actually. But this pathologist from Hamburg called Causal has examined about 200 bodies by now. And he hasn't found a single case where he argues that it's actually the virus or the disease that has led to the death. And it's in all cases, it's actually the underlying condition. But it doesn't really matter how many, but it's the vast majority of cases where you have something like the following condition, following situation. You have the virus that causes the disease and the patient dies. But you have significant underlying health conditions such as a cancer, hypertension, obesity, all these kinds of things. That very likely would also have led to death, but somehow the virus may have caused a complication. So this is I'm using this this bar here with the two dots at the end to show that there is interaction between these two factors. So it's really that the underlying health condition wouldn't have caused the death on its own, but it's also the case that the virus wouldn't have caused the death on its own. So there is interaction between these two factors. Together, they led to the death. I mean, that is what we know essentially. And again, I'm talking about the conceptual issue here. So that is all there is to be known about these cases. That's all there is. So in these cases then, structure, both coronavirus and the underlying conditions are so-called Inus conditions. And I will not define them here. I just presuppose that you all know what they are. However, the problem with this is if we want to draw a distinction between dying with and dying of, we can't do that among Inus conditions because all Inus conditions are causally on par. There is no distinction between cause and condition. So in the Mackey examples, you have the lighting of the match, the striking of the match. So the striking of the match is the cause of its lighting, but you have the presence of the oxygen, which is a condition. However, causally they're on par, right? So the match wouldn't have lit if it hadn't been for the oxygen, but it also wouldn't have lit if it hadn't been for the striking, right? So causally, they're really on par. Differences between causes and conditions are at best pragmatic. And clearly, pragmatics plays a role in these medical cases because having a heartbeat is also an Inus condition of dying with or of coronavirus, right? If you don't have a heartbeat, you die of that before the virus can kill you or any underlying condition. And so there is a difference here between cause and conditions, but not between coronavirus and underlying conditions. And so unlike having a heartbeat, both coronavirus and the underlying conditions genuinely seem to explain death, right? So we're looking for explanatory factors rather than background factors, but that is the case for both the underlying, so-called underlying conditions, hypertension, cancer, diabetes, what have you, and coronavirus. So there's no sort of explanatory difference between those. So we have to look at a difference between coronavirus and underlying condition elsewhere. We can't just look at these different Inus conditions and see some are explanatory, others aren't. Having a heartbeat doesn't explain the death. It's an Inus condition, but it doesn't explain the death. But that is both coronavirus and the underlying condition seem to explain the death. So I do see that in some cases there may be an ontological asymmetry here. Namely, if you look at processes and you look back at the death and you try to connect the steps, the events that led up to the death. And then it may be that in some cases you have the virus causing the disease, and then the disease, the underlying health condition, would have at some point led to the death, but that process is interrupted by something initiated by some of the symptoms caused by the virus. So that is represented in this graph by this horizontal bar with the dot with a hole in it, with a circle, that somehow blocks, prevents the underlying health, the process of the underlying health condition to come to completion. And then it's the COVID-19, the disease that actually did it, that led to the death, right? And I think this reading is actually consistent with the WHO recommendations of how to fill in death certificates. So if you look at those, the coroner or the GP who fills in the death certificate is asked actually to fill in those steps that led to the death, with one exception actually, and you can see that in this example here. So you have the suspected COVID-19, where in this particular case, people are not sure, and it doesn't matter whether people are positive or not, but it's suspected that the process was initiated by an infection with the SARS-CoV virus. That led to pneumonia, that led to acute respiratory distress syndrome, and that led to the death. And then there are other conditions which are merely, which the process through which those would have led to death has been interrupted by the COVID process. And in this example here, we have coronary artery disease, type 2 diabetes, chronic obstructive pulmonary disease, all of which could have led to death, but in this particular case, they actually didn't. I want to distinguish that from, and because a lot in this sort of in this critical, in this literature, these articles and YouTube videos and so on of people who are critical of the anti-corona measures, they very often say, well, look, currently the way the certificates, the death certification is practiced, what happens is that any death that is corona positive is counted as a corona death. But this is not in fact true, at least not in the Health Organization recommendations. Because if you have a significant alternative cause of death, in this particular case, a motor vehicle accident that led to aortic dissection, which led to hypovolemic shock, so essentially blood loss, and that caused the death, you have a nice alternative story to tell. And even though that person was corona positive, that is not, at least not recommended to be counted as a corona death. So if people say that, well, look, there are people hanging themselves and they, they're tested corona positive, those are actually not officially counted as corona deaths, or at least shouldn't be counted as such, according to the World Health Organization recommendations. Anyway, so unlike in the structurally fairly similar stock example of Billy and Susie throwing rocks. So, you have two processes here, and then essentially because one came to completion, it interrupts the other process. These processes in the corona case are not fully independent, because it's really due to, the underlying condition plays a causal role, because without the underlying condition, the patient wouldn't have died. However, at the end of the day, as it actually happened, it's this process, the corona process that was initiated by the virus, is the one that did it in the end. And so it is similar in that respect. So the virus made a difference, but one like the last straw that broke the camel's back, right? So the patient would likely have died anyway, but in this case, it is the virus that actually did it. So that's the situation. However, in standard medical practice, and that's really important for my story that follows, in standard medical practice, conditions that make a difference in that manner are not called causes of death. And so ordinarily in these cases, if you have a patient, let's say, who has lung cancer, who develops, let's say, pneumonia from infection with some flu virus, and then who dies, then even though it might have been the flu virus that caused the death as it actually occurred, this is counted as a death due to lung cancer. And similarly with respect to other underlying conditions. So here you have a quotation from John Lee, giving a number of examples. Consider some examples. An 87-year-old woman with dementia in a nursing home, a 70-year-old man with a metastatic bladder cancer, a 29-year-old man with leukemia treated with chemotherapy, a 46-year-old woman with motor neuron disease for 2 years. All develop chest infections and die, all test positive for COVID-19. Yet all were vulnerable to death by chest infection from any infective cause. And that's really important, from any infective cause, including the flu. COVID-19 might have been the final straw, but it has not caused their deaths. And that is actually standard medical practice, that if you have a significant underlying condition, and then it's the flu that kills you, this is not a death due to, let's say, pneumonia or due to the flu, due to any specific virus that caused the flu, caused the pneumonia, but rather due to the underlying condition, whatever it is. And actually, from an epidemiological point of view, this makes a great deal of sense. Given the frequency of viral infections in the population, an infection is regarded as a background condition, much like Mackey's oxygen in the air, when the cause is actually the lighting of the cigarette, right? So you have an explosion, you know, the oxygen in the air is an inert condition. However, you regard the lighting of the match as the lighting of the cigarette as the cause. And it's similar in this case, where, because essentially everybody is subject to, you know, infection with the flu or with some other virus. And so what stands out in this case, even though it's the flu that might have done it in the end, but what stands out in these cases is the underlying condition. That is sort of the abnormal thing. That is the deviation from the normal that we as epidemiologists count. And so note that this pragmatic distinction between, you know, two minus conditions, you know, two conditions which are causally on par, but which are pragmatically different, is based on in part on what is expectable and significant, right? It is based on what, you know, on the frequency of diseases. Look, almost everybody gets sick with the flu at some point, right? But it very rarely kills. That's very different with respect to lung cancer. It's a fairly rare disease, but when you have it, it's very likely that you actually die of it. And so if you certify a death, even if in this particular case, it's, you know, the flu that pushed him over the edge, you call this a death due to lung cancer or whatever condition they have. And so while there is an ontological distinction, so, you know, there is this process initiated by the virus that comes to completion, and the process initiated by the cancer or diabetes did not come to completion. Standard medical practice rejects looking at that difference, but for good pragmatic reason, I think. And so again, here's a quotation from an old book of recommendations from the World Health Organization, medical certification of cause of death. And so they say that in most countries, certificates of cause of death have a dual purpose. Firstly, they contribute to the legal record of the death. Cause of death may be significant in insurance, cause of death may be significant in insurance or inheritance matters. Secondly, they are the source of mortality statistics, which have an important part to play in medical research. Untimely deaths are to be prevented. Untimely deaths are to be prevented. The chain of events has to be cut or cure instituted at some point. The most effective public health objective is to prevent the precipitation cause from operating, right? And so you see here that from an epidemiological point of view, what we have to look at is factors that we are willing to prevent. And because viruses are so ubiquitous, that's not what you want to target. What you want to target is something like lung cancer, which you can prevent very easily, for example, by stopping smoking, right? And so that is why we draw this distinction. This is why a death, which is actually caused at the last second by a virus, but because the virus is ubiquitous, what we can stop is the smoking and therefore the lung cancer. And this is why this is recorded as a lung cancer death. I'm sorry, I have to. So what is regarded as a cause of death is in part a question of treatment and prevention. And this is just an aside, actually. So a complication arises for what I call the clear-cut cases of death due to corona. In official mortality statistics, the cause of pneumonia is not given. So pneumonia is very often when there are no underlying conditions, no further underlying conditions. The cause of death is lower respiratory infection, but the cause of that is actually not given. And the reason is just that there are many different viruses, bacteria and fungi that can cause pneumonia. And again, they are everywhere. And so what you want to treat is not infection or exposure to these viruses or bacteria or fungi, but rather the development of a severe case of pneumonia, right? And so again, even if a patient doesn't have underlying condition and he's actually or she is actually killed by pneumonia, then you do not call that a case due to the flu or due to that bacterium or whatever that causes it, but rather it's a case of pneumonia, because pneumonia is the thing that you can treat and prevent. You cannot prevent exposure in general. You cannot prevent exposure to any of these different viruses, bacteria and fungi. And so I'm just repeating that here. What can be treated and prevented is pneumonia. In some cases, for instance, by intervening on a comorbidity or on environmental factors such as diabetes or smoking. The point is, death due to corona would ordinarily be classified as death due to pneumonia and not due to corona. That's also important. Now, might there be a clear, if pragmatic, distinction between dying off and dying with, after all? The problem is that preventability is not a fully objective notion, right? However, what is preventable is in part a matter of sort of technological, physical, physiological possibility. And in that respect, it may be more or less objective. But in part, it's a matter of normative considerations. For example, of cost and benefit trade-offs regarding acceptability of, sort of anti-exposure measures, and so on and so forth. So what we regard as preventable is, not just out there. In part, it's, a function of what we regard as acceptable in terms of, what are we willing to do? What are we willing to pay for a potential treatment, a potential prevention of a disease? And so here's one straight other example. So someone who would have died anyway of some underlying condition, but was a victim of medical malpractice, died from negligent action. And so in this case, we have an alternative cause. He would have died anyway. However, because medical malpractice is something we would like to prevent, and normatively we think we should prevent, in this case, we regard that as the cause. And now corona, and that's really the novelty, and I think why there is still ambiguity in determining whether this is a case of due to corona or with corona. Corona seems to have led to a change in thinking about what is acceptable in terms of disease risk and in terms of preventative measures. Before corona, a patient who contracted pneumonia from, let's say, the swine flu or some other flu, had no underlying conditions and died, would have increased the pneumonia death toll, or if an underlying condition was present, the death toll of that condition, lung cancer or hypertension or whatever it is. But when the infection with a given virus becomes more preventable because certain measures become more acceptable, so suddenly we seem to be thinking that we can actually prevent the spread of that particular virus. We can prevent that particular virus from spreading. So certain measures become more acceptable, and specific treatments, namely vaccines, become available or at least conceivable. Then it makes a lot of sense to count these deaths as deaths due to that virus, right? So what has changed is not so much anything in the ontological structure of the cases, but what we regard as preventable and normatively as what we should prevent, right? And so at this particular point in time, I think the distinction is unclear because there is significant disagreement about the relevant norms. And so it seems at this point that most governments and some parts of the population, a large part of the media actually, seem to have accepted that protecting against this specific virus is not only necessary, but also feasible, but others disagree, right? There's this disagreement of the normative point, right? What seems sensible as a preventive measure? And that translates into this conceptual confusion between dying off and dying with. And so I want to end here with actually something that is a situation that is quite ironic. So it is the values of those people who are critical of the anti-corona measures that undermine the distinction that they use to criticize the measures, right? And so it's disagreement about these values. So it is some parts of the population that thinks it's entirely acceptable to try to prevent the spread of this particular virus. Other parts of the population thinks, well, no, that is too costly. And because there is this normative disagreement, that disagreement translates into the conceptual confusion between dying off and dying with. So, and just as a last sentence, if everyone agreed that infection with SARS-CoV-2 was a condition against which we should protect the population and for which society should develop treatments, the WHO recommendations could be used to draw that distinction. So it would be a clear-cut distinction if only we all agreed on the values, right? If we agreed on the norms. And that's my story. So thanks a lot for